Welcome to the explainer. A child can't always use their words to tell you what's wrong, but their body sends signals. Today, we're going to decode some of those subtle clues, the ones that can mean the difference between a simple bug and a real emergency. We're going to learn how to spot the critical red flags that really demand action. All right, let's jump right in. We're going to walk through 5 very different scenarios, and in each one, the key is recognizing one single specific danger sign. It might be something you see or something you measure, but it's the thing that can change everything in a hurry. Okay, first up is a danger signal that you can actually see, which is pretty powerful. It's a very clear visual sign that a child's body is literally fighting for every single breath it takes. So what you're looking for is right here, at the base of the neck. When an airway gets narrow, the body has to work overtime, creating this intense negative pressure just to pull air in. It's pure physics, really. That suction is so strong, it literally pulls the soft skin inward with every breath. The best analogy? It's like a vacuum cleaner trying to suck up something when the hose is clogged. Now, when you see these retractions, your first thought might be croup, especially if you hear that classic barking cough, and you wouldn't be wrong. But they can also signal something much rarer and much more dangerous, epiglottitis. The key is looking at what else is going on. With epiglottitis, you probably won't hear a cough. Instead, what you'll see is a child who is incredibly anxious and drooling. That's a huge difference. And this is where we get the classic 4 Ds of epiglottitis, and honestly, they all point back to one single root cause: massive swelling. The distress is because the airway is blocked. The drooling happens because it hurts too much to even swallow their own saliva. And the dysphagia and dysphonia, trouble swallowing in a muffled voice, it all points to one terrifying possibility. That airway is about to close up completely. Okay, this leads me to maybe the single most important rule here. If you suspect epiglottitis, you must never, ever try to look in the throat. I know, it feels like the first thing you'd want to do, but here's why you can't. Even just the touch of a tongue depressor can cause a spasm that slams that swollen airway shut instantly. It's a critical, life-saving rule for a truly life-threatening moment. Okay, next up, we're going to look at a powerful heart medication that, well, it walks a very, very fine line. It's amazing at what it does, but it operates on a razor's edge between being helpful and being straight up dangerous. And this is what I mean by a fine line. Look at this tiny range, just 0.8 to 2 nanograms per milliliter. That is the entire safe and effective zone for the medication digoxin. That's the sweet spot. A little bit below that, it doesn't work. A tiny bit above it, it's toxic. There is basically zero room for error. And this chart here, it shows that tightrope walk perfectly. When you're in that therapeutic range, the heart contracts just like it's supposed to. But the second you step outside of it, the body starts to rebel. You get nausea, vomiting, but the most alarming one, the big one, is bradycardia. That's a dangerously slow heart rate. So because that slow heart rate is the biggest, scariest red flag, this 4-step safety check isn't just a suggestion. It is absolutely mandatory before every single dose. And you have to count for 1 full minute, no cutting corners. This isn't just ticking a box on a chart, it is the main line of defense. It's how you know for sure that the child's heart is in a safe place to even get the medication. All right, let's switch gears and talk about signals from the gut. We're going to look at 2 very different conditions. One is basically a structural, a plumbing problem from birth, and the other is a genetic disorder. But they both send out these very clear but very different distress signals. So first is Hirschsprung disease. Just imagine a highway, but for one section, the road crew completely forgot to lay down the asphalt. What happens? Traffic just stops. It's a dead end. That's basically Hirschsprung's. A piece of the intestine is born without the nerve cells that create the muscle waves to push things along, so you get a total blockage. So how do you fix a missing piece of highway? Well, it's a multi-step journey. First, the surgeons go in and remove that segment of bowel that doesn't work. Then, to give that area a chance to heal up without any traffic, they often create a temporary detour, an ostomy. This lets that new connection get really strong before it has to get back to work. But here's the thing. Even after a totally successful surgery, you're not out of the woods yet. The biggest risk they face after the operation is something called enterocolitis. It's a severe, really dangerous inflammation of the bowel. It's a huge complication, which is why teaching parents to spot the early signs is priority number 1. Okay, now let's look at a completely different signal from the gut. this time from cystic fibrosis. Here, the problem isn't a blockage in the road. It's more like the gas stations are all closed. Thick mucus blocks up the pancreas, so the enzymes needed to digest food can't get out. So the body just can't absorb any nutrients. The signal isn't a blockage you feel, it's a failure to thrive that you can see. All right, pretty much everyone knows that high blood sugar in a kid with diabetes is a problem. But here's the thing, that high number on the glucose meter, that isn't always the real emergency. There's a different, much more urgent signal that tells you when things are getting truly critical. So when does it actually tip over from just being a problem into a life-threatening event? The answer isn't just in that glucose number. It's all about what the body starts to do when it's starving for energy, even though it's floating in a sea of sugar it can't use. The real danger signal, the one you have to look for, is ketones. See, when the body can't use sugar for fuel, it panics and starts burning fat instead. Ketones are the acidic junk left over from that process. And that's exactly why these moments, high blood sugar, being sick, being stressed, are immediate triggers to check for them. No waiting. Here's a great way to think about it. High blood glucose? That's like the temperature gauge on your car's dashboard creeping up into the red. It's a warning, right? It tells you the fuel system isn't working right and the engine is starting to overheat. But when ketones show up, that's the red oil lights starting to blink frantically on the dash. This is a much, much more serious alarm. This means the engine is out of its proper fuel, and it's started burning its own essential parts just to keep from dying. And if you ignore that blinking oil light, what you get is DKA, diabetic ketoacidosis. That's it, the engine is seizing up. This is a full-blown medical emergency. Catastrophic failure is right around the corner. Okay, for our last one, let's look at a pretty common therapy for breathing problems. It seems really straightforward, but whether it's actually effective, well, it all comes down to answering one very simple question. And this right here is the whole ballgame. Chest physiotherapy, or CPT, is designed to do one thing and one thing only: physically shake thick, sticky mucus loose so it can be coughed out. So for a condition like cystic fibrosis, where there's tons of mucus, CPT is a game changer. But if the problem is just swelling with no extra mucus to clear, then doing CPT is like shaking an empty jar. It does absolutely nothing. So whether it's that little dip in the neck with a breath, a pulse that's just a little too slow, or the presence of ketones, these aren't just random symptoms. They're the body's language. And learning to spot these patterns isn't just about memorizing a checklist. It's about developing an intuition, about learning to see the one critical signal through all the other noise, so you can act when it really truly matters the most.